Hello, I'm Gerry Breen from First Aid Supplies. I'm not a medic, but I'm hoping the demonstration today will give you the information and confidence you need if you're ever in a situation where it's necessary to try and save the life of someone in your community. These are the two BeneHeart models. This one has a screen, this one doesn't have a screen, both identical in every other way. So I'm just going to show you what's involved with a BeneHeart defibrillator. On the front here, you have the date code with the pads. There's a light that shows green when the defibrillator is working and ready to use. I'll open the defibrillator. I've taken the battery out so we're not getting too much noise. Here you have the pads. They're the two electrodes, two pads that you place on the patient in order to deliver a shock to the patient. I'll just show you them in a minute. Also, you have a child-adult switch. So there's no need for different pads for different patients with the BeneHeart defibrillator. A child is defined as 25 kilos weight or under, 8 years of age or under. But in most situations, it will be an adult that will require shocking. And the BeneHeart is unusual in that it can deliver, it picks up if a patient is overweight and delivers a stronger shock to that patient in order to get through to the heart muscles, in order to try and get that heart working again. With a child, obviously, the shock level is lower. I'll just show you the pads also. And we've opened a set of pads here for demonstration purposes. And these are placed in the chest. It's so simple that it actually shows you where to place the pads on the chest. So this one here is for the top left of the patient, about here, and this one is along the side to the right. And what it does is it delivers a shock to the patient in between the two pads into the heart muscle. In Ireland, the protocol for CPR defibrillation is 30 compressions, 2 breaths. 30 compressions, 2 breaths. And that's you continue that till an ambulance arrives. Also, the depth of compressions is about 2 inches. So it's critical when you're performing compressions. It's a very tiring exercise. If there's help available, make sure you have backup. I'm going to take you through the demonstration of the BeneHeart defibrillator. With both models, to turn it on, all you do is open the lid. This is a demonstration model. It's identical. We've placed the two pads of the patient. It's analysing the patient to see, do they require a shock. It's telling you they need a shock. It flashes a button.
Press flashing shock button. Shock
You've delivered the shock to the patient. It's telling you to start the compressions.
To give 30 compressions and 2 rescue breaths.
So it's like a billows, working a billows. You're pumping blood around the body. One critical thing is, as rescuers work, it's very stressful and also physically tiring.
Give 2
You can also start leaning on the patient.
1, 2.
As I was saying,
Continue with compressions.
it's important to press and release. Press and release. Don't be afraid of being strong. You're trying to help the patient to survive. And that's the demonstration for the BeneHeart defibrillator. The BeneHeart defibrillator, I hope you've seen how easy it is to use. It's also the fastest and the smartest defibrillator available. It comes with a 5-year warranty, 5-year pads and 5-year battery. Sort of simple to follow. But if you're in a community where a pub, a club, a workplace, outside a pharmacy has a defibrillator, I would ask that you check the defibrillator out, that you make sure that the pads are working, that the battery's working, and also the defibrillator itself is working. If in doubt, give us a shout. We have a free phone number, 1-800-FIRST-AID. That's 1-800-FIRST-AID. Or you can go on our website, www.firstaidsupplies.org. That's firstaidsupplies.org. Thank you.